Hello moms and moms-to-be, welcome back to Baby Care by Tina. Today's video is all about how to get a proper latch while breastfeeding, one of the most important skills for comfortable and successful nursing. A proper latch helps your baby get enough milk and prevents common problems like nipple pain, cracks, and poor weight gain. If breastfeeding feels painful, chances are the latch needs adjustment. Let's start with positioning. First, make sure you are comfortable. Sit or lie down in a relaxed position with good back support. Bring your baby to your breast, not your breast to your baby. Your baby's head and body should be in a straight line, facing your breast, with their nose opposite your nipple. Now, encourage your baby to open their mouth wide. Gently tickle your baby's upper lip with your nipple. When your baby opens their mouth wide like a yawn, quickly bring them onto the breast. Aim your nipple toward the roof of your baby's mouth, not straight in. A good latch means your baby takes in not just the nipple, but a large portion of the areola, especially the darker area below the nipple. Your baby's lips should be flanged outward, like fish lips, not tucked in. The chin should touch your breast, and the nose should be close but still free for breathing. You should notice slow, deep sucking with pauses, and you may hear your baby swallowing. Breastfeeding should feel like gentle pulling, not sharp pain. Mild tenderness in the first few seconds can be normal, but ongoing pain is not. If the latch feels painful, don't hesitate to break it and try again. To break the latch safely, gently insert a clean finger into the corner of your baby's mouth to release suction. Never pull your baby off suddenly. Different breastfeeding positions can help improve latch, such as the cradle hold, cross cradle hold, football hold, or side lying position. Experiment to find what works best for you and your baby. Remember, every baby and every mother is different. Learning to latch properly takes time and practice. If you're struggling, seek help from a lactation consultant or healthcare provider. Early support can make a huge difference. Breastfeeding is a journey, and you're doing an amazing job by learning and trying. Stay patient, stay confident, and trust your body and your baby. Thank you for watching Baby Care by Tina. If you found this video helpful, don't forget to like, share, and subscribe for more baby care tips. Sparkling Heart.